Good afternoon, everyone. Just to give you a little bit of background, I was born in Trinidad in the West Indies, migrated to Toronto in 1970. I've been in practice 4.5 decades. I actually retired 7 years ago because I wanted to do more about education to the world. So just 2 days ago, I published my 20th book. And for all of you today, I chose one book to bring to every one of you today. So you'll leave with this. This book stipulates that ask Dr. Bob and Elvis how to maintain your health. Assessing that divine force within us to attain or regain and maintain divine health. One study that I remembered when I was at the naturopathic college, there were a group of people suffering from cancer. So they divided them into two groups, as most double-blind control, placebo-controlled studies are done. And a pastor would go into one room and sit down. In the other room, with the other patients, he would say a prayer. After a couple of months, the group that listened to the prayer had a better prognosis. So when you hear prayer is very important, when I was a young boy, I didn't believe so much about prayer. In fact, I was out every day, as most of you, and we were young, playing sports, exercising, which I still try to do as much as I can. But in my traveling journeys since 1979, being a practitioner, exercise is important. Good nutrition is important, but having that belief, that spiritual belief that is in the inner part of your health. And this morning, getting up very early to do my prayers, as I do every day, I put on the TV station in the hotel. And on the TV station, there's a documentary about Ayurvedic medicine. Who would have thought from when I was in pre-med in the 70s, people would have television shows talking about detoxification and cleansing. So we had a slogan in my practice: not only you are what you eat, but more importantly, that I learned from Harvard when I studied mind-body medicine at Harvard Medical School, what you think. You think positive. We all have stresses, but you turn that into positive stress. We all have negative stress and positive stress, but when I did my PhD to attain my doctorate, how stress affects nitrogen balance, we're able to, with the help of labs, to test the creatine. When people are stressed out, they secrete more things from our bodies, creatine, and you can measure before and after. We were able to show that when we all have stress, we break down protein. That's why we get sick. We don't get sick before we had exams. We all got sick, most of us, very educated, we go to school, we get the common cold, the flu-like symptoms after the exams. That's when the body is healing. We're more relaxed. That's the healing center. People come in, we help them to relax, cleanse, detoxify, and attain optimum wellness. The difference between allopathic and naturopathic is that working with a clinic with Dr. Singleton, our role would be to complement. Not to say that our medicine is better. Mind you, people may question that, because when I studied at Hong Kong Baptist University, I was in Shanghai and Korea, the medicine taught there is not 200 years old. It's much, much, much longer. When you look at massage therapy, Ayurvedic medicine, and you saw one of the slides, the homeopathy suite there, it's been around for longer than allopathic medicine. So when I look at the studies that people are doing, there's a source of argument, which is better. The keystone is we are in the business for preventive medicine, prevention. Medical doctors are great in surgery. I still play ice hockey. If I was to injure my arm or have a fracture, I'd be going to a surgeon. I wouldn't be going to an osteopath or get an acupuncture treatment. It just alleviates the pain. I need surgery. So studies were discussing which one to treat, which one to choose, and which one is more efficacious. I think both are. And the key thing is diagnosis. So when you have lab diagnosis, when you have a doctor that's examining, for example, when we learned in China, we may not have access to do lab work. In this place, we do, because we're working together as a team. But when you work as a naturopath, one of the trainings that we were taught in Chinese medicine, twitching of the eyes, redness of the sclera, pulse diagnosis of the liver organ, unheard of in medical allopathic training in North America. They don't look at these things, so we could complement. Looking at the tongue, it tells you what organs are affected: the liver, the heart, the spleen, the stomach, large intestine, small intestine. So Chinese doctors many years ago, if you're a good doctor, the patients were healthy. And in Canada, it's the opposite. Doctors are well noted to do very good work, but usually patients wait last minute, then they go to the doctors. So in intertwining allopathic with naturopathic, it's a great symbiotic relationship. It's the key that I always tell people, that we work together, get a proper diagnosis, and then you get the proper treatment. Don't listen to everything you read on internet or